give you very accurate information about the status of your arteries of the heart. And that probably would be a much better test than just doing a treadmill test.
Which is where they're asking about how sleep affects our heart.
So adequate sleep is so important, because once again, if you are having adequate sleep, especially REM, which is REM sleep, which makes you relax, all your hormones come down. And if you're not getting enough sleep, then effectively you are in a state where every hormone of your body is elevated all the time. You know, your stress hormone, cortisol, adrenaline, noradrenaline, which is not good for heart.
And what about menopause? How does that affect?
So women traditionally are protected because of those so-called estrogen and progesterone. But post-menopausal, women certainly are at increased risk of heart disease. Now the problem is, the traditional approach was to give hormone replacement therapy, but hormone replacement therapy has its own problems with breast cancer, clot in the artery, and other risk factors. So we have to be very careful in prescribing hormone replacement therapy. Therefore, instead of doing that, we have to minimize other risk factors, taking care of blood pressure, exercise, healthy eating, that will minimize the risk of developing heart disease.
So there's another interesting question. Somebody is asking about cholesterol. What if the cholesterol is very low in the body?
Right. Very low cholesterol. That doesn't happen, frankly speaking, and that does happen used to happen with HIV patients. One of the hallmark of HIV patients was low cholesterol, literally almost negligible cholesterol, because the liver is damaged and liver is not producing cholesterol. So the only situation where you'll have very low cholesterol would be if your liver is not functioning well. If somebody's liver is functioning well, there is nothing like low cholesterol.
Correct. So is fatty liver and heart disease also related, sir?
Yeah, so fatty liver again is part of metabolic syndrome and insulin resistance and obesity. So you're more likely to get fatty liver. I'm talking of non-alcoholic fatty liver. So there are two types of fatty liver. One is alcoholic. So alcohol intake induces a fatty liver, which is a different fatty liver.
Yes.
But non-alcoholic fatty liver is largely due to your increased weight or insulin resistance due to diabetes. So again, it's all part of metabolic syndrome. You're mute. Aisha, you're mute.
Difference between cholesterol. Cholesterol, we understand it's a type of a fat molecule. What is the difference between the body fat, overall body fat, and the cholesterol?
Yeah, so cholesterol is a substance or is an end product of your metabolic pathway, which is produced by the liver. And your body composition of fat is a completely different entity that is just in the tissues, that is not coming into the arteries. But cholesterol is circulating into your arteries because we measure cholesterol in your blood.
That's the fact that whether you take it from the food or you not, it is produced by our body what may and in an adequate amount. And cholesterol to a certain amount is also good because it helps in hormone production, right? So that's why body produces a certain amount of it, right? So another interesting question is, a lot of people, it might not be a heart attack or it might not be something related to heart, but they complain of pain in the left hand, right? So what could be the underlying reasons for this?
Okay, so there could be many reasons for pain in the hand. So traditionally, our thinking is that if we are having heart disease, the pain in the chest gets radiated to left arm. And that's because of the nerve distribution is common between the left arm and the chest area. That's why. But just having pain in the left hand doesn't mean that it is heart. It could be nerve pain because of any other reason. It could be muscular pain because of any other reason. It could be median nerve compression here, which is typical.